Good day, my name is Imelda Williams and I'm responsible for the unit for RAD5108. So with this presentation I'm going to introduce you to the clinical portfolio. It is expected that although you might not be radiographers, that you should have access to imaging wherever you are doing your clinical practice. So I'm the academic person who's responsible for this unit as a whole, so in providing the materials but also undertaking the assessments. So RAD5108 and the clinical portfolio is related to the learning outcomes 2 to 5, so refer to those in the unit guide. Resources will be the unit guide, the Moodle site, also use the image interpretation manual, and then the video recorded presentations. So for the clinical portfolio, there will be 2 sections to it. You need to submit a minimum of 6 clinical cases, and then the second one is to provide a self-auditing of the preliminary image evaluation record, and the submission deadline for that is the 21st of June. So as mentioned, there needs to be 6 cases. Each case should have a word limit of about 200, so that will make up 1,200 words in total. And you need to include a range of body regions related to the cervical spine, the shoulder, and the upper limbs. You can use references to support your discussion. You need to include, as appropriate, the importance of the mechanism of injury, also justification of exams, what radiographic projections were taken, were that sufficient, or did you actually need to do additional projections, and then provide de-identified images of each case, and then provide a preliminary image evaluation. Then compare your PIE evaluation to that of the radiologist's report, and if applicable, you can discuss the immediate management of the patient. So for the self-auditing PIE record, you need a minimum of 10 reports, and again it should cover a range of the cervical spine, shoulder, and upper limbs. You then need to work out your true positive, true negative, false positive, false negative rates, and then calculate the following: the sensitivity, and there's the formulas for all 3, the specificity and accuracy, and then finally provide a brief reflection on the personal preliminary image abilities. So to allocate the true negative, true positive, false negative, and false positive, you might need to use fractions, especially if there's more than one abnormality, and then summarize your results in the proposed spreadsheet. And then, as mentioned, you need to calculate sensitivity, specificity, and accuracy. So in determining the following, so for true positive, if the radiologist report states that the case is abnormal, you need to, and if you have also decided that it's abnormal, then that is a true positive. However, if you are unsure and you think it might probably be abnormal or possibly be abnormal, that will still constitute to a true positive. With the true negative, if the radiologist's report is normal and you identify that this is also definitely normal, however, if you identify that it could be possibly normal, it will still be a true negative. If we look at the false positive, if the radiologist's report says it's normal and you state that it's definitely abnormal or probably or possibly abnormal, that is a false positive. And if we look at the false negative, if the radiologist says it's abnormal, however, you had a PIE comment that it's definitely normal or possibly normal, that will be false positive. You then have to pop that into the 2 by 2 table. So for the true positives, that's where you compare it to the radiologist's report, which is the gold standard, your false positive results, false negative, and true negative. And that you can put into a spreadsheet then. And as I said, it needs to cover a range of body areas specific to this unit, and it will be marked out of 10. So important to note that with sensitivity, you want it as close to 100%, because what that means is you have the ability to pick up most or all of the abnormals. So you want to keep the false negatives to very little. If you look at specificity, once again, try and get that as close to 100%, and that will mean that you are able to identify the normals very well and that there is very few false positives. And it's very useful where there is a high risk associated with unnecessary treatment. The accuracy is the ratio of the true positive plus the true negative results to that of the number of patients studied, and that is the formula you need to use to calculate the accuracy rate. So in summary, you need to collect a range of clinical cases and then include normal as well as abnormal cases, and then please contact me if you need any further clarification. Thank you.